Hey guys, so for those of you who don't know, I actually used to work full time as a medical assistant in an urgent care clinic, and I had been asked a long time ago and just never made a video about it for whatever reason. I'm sorry I overlooked the question, but somebody asked me what are the most common things that we treat in an urgent care clinic. And so I made a list on my phone. So if you see me looking down, it's because I do have my phone out so that I don't miss anything. And obviously, this is not an exhaustive list because we saw a bunch of pretty much anything and everything at the urgent care clinic that I worked at. I worked at a rural critical access hospital. And so we could see literally anything and everything. And we were open 7 days a week, 365. So um, we weren't open as long as the emergency room was. Like the emergency room was open 24/7, 365, but we were open literally every day, even holidays. So without further ado, I'm going to go through the list of the most common things that we saw in the urgent care. So respiratory issues like the common cold, the flu, COVID-19, and we actually could test people rapidly, or if somebody had been around someone who had tested positive for COVID, we would usually, like, until we ran out of them, we would give them a package of home tests to go through, because usually what we would tell people is if you were around somebody, like exposed to somebody who tested positive for COVID-19, it's best to just assume that you have it. Um, if you're having symptoms, it's best to just assume that you have it instead of having to spend, you know, $150 to $200 to do our rapid testing. Some people followed through on that. Other people would rather just get tested. So it just kind of depended on what the patient wanted. Bronchitis, sinus infections, that was a big one. Strep throat was also a big one. COPD exacerbations, or flare ups of asthma. So we would have a lot of those come in. Um, as far as GI problems, we would have stomach flu. Sometimes we'd get the occasional food poisoning, but that was not really as common as some of the other ones. Nausea and vomiting, diarrhea, constipation, mild dehydration, which in the urgent care clinic that I worked at, we couldn't really treat the dehydration. So, like, if somebody needed an IV, we did not have the capabilities at the urgent care clinic that I worked at to treat someone, to like give them an IV. So, they would have to go from us over to the ER, and we would literally just call the nurses over in the ER and let them know that we were bringing somebody over who needed an IV or whatever the case may be. So that was a good thing about being attached to the hospital, because we were in the farther end of the hospital, but we were attached. So we could just walk somebody over to the emergency room if they needed emergency care. Another thing we treated was infections. So we saw a lot of UTIs, ear infections, or people who had like a buildup of earwax, things like that. We had the capability of removing their earwax, or at least trying to help them. So we would do that. We would flush their ears, things like that. Pink eye, hand, foot, and mouth, skin infections like cellulitis and abscesses, yeast infections, BV, things like that. We could test them and treat them for that. We also had people who came in with like dental issues, dental pain, and dental abscesses, because where I live at in the Upper Peninsula of Michigan, there's not a lot of dentists who are accepting new patients, or if they are accepting new patients or patients with Medicaid, there's a long wait. So they have to wait like months and months or even a year to get into these dentists. So we would treat them until they were able to get to the dentist. But usually we would require them to have a dental appointment before like the providers would give them any sort of pain medication longer than just a week. So we would also treat minor injuries such as sprains and strains, minor fractures. We would only do splinting. So like if somebody came in and we got x-rays and stuff done If it was broken, we could sometimes, like if it was a broken toe or something like that, we could just split them because there's not really much you can do for a broken toe. We could give them a walking boot so that they could, walk. But if it was a major break, we would send them a referral to ortho. We would send them to the emergency room to get casted because we didn't have the ability to cast. The emergency room did, or else we would put them in a hard splint and we would give them time, like, to get to that ortho appointment, and hopefully they were able to get there sooner rather than later. Um, Minor cuts and lacerations needing stitches. We also would use skin glue, depending on where it was on the body. There were some providers that, depending on where the lacerations were, did not want to do stitches. We could also staple, but again, it just depended on the provider, where the laceration was, and things like that. Burns, minor first degree burns, we would treat. Insect bites and stings. There was a whole lot of like tick bites and things like that. People who were scared that they had Lyme disease, we would test them for that. So there's that. And then skin conditions like rashes, including allergic reactions, if they were minor. If they were major allergic reactions, like they were having trouble breathing, we would tell people that they need to go to the emergency room because we had oxygen, but like as far as intubation and things like that, we couldn't do that in the urgent care clinic. We would have to call a code, like a rapid response or whatever, if somebody was coming in to us needing something like that. So we would tell people if it was something that serious that they needed to just go to the emergency room. Poison ivy or poison oak, eczema flare-ups, hives, things like that we could treat in the urgent care. And then other common complaints were mild allergic reactions. Again, that's kind of with the rashes. Headaches or migraines, non-severe. If it was a severe headache or migraine, we would tell them to go to the ER because the ER had more capability of treating them. Back pain, we could treat to a point. If it was due to an injury that because like in the urgent care, we didn't have the capability to do anything more than an x-ray. Like we couldn't order a CT or an MRI to be done on an urgent basis. So we would send them to the emergency room because the emergency room could order those things on an urgent basis to where they would get done a lot sooner than if we ordered them. Because if we order them, you would have to wait until someone was available to call you back to schedule that. And then minor nosebleeds, which we didn't get a whole lot of, but we did get nosebleeds a little bit. So that is my list of things that we would see in the urgent care. If you guys have any questions or any comments or suggestions for topics you would like to hear me talk about in the future on my channel, let me know. I am more than happy to talk about my experiences as a CNA, medical assistant, phlebotomist, sleep tech, and now that I am training to become a certified ophthalmic technician, I would be more than happy to share my journey with that as well. So with that being said, that's all I have for today's video. I hope you guys have a wonderful rest of your day, and I will talk to you guys in my next video.